All right, I have 7:29, so we'll start in approximately 2 more minutes. All right, good evening, everyone. Thank you again for joining us this evening as we have a special meeting to discuss secondary reopening plans, as the board had asked the administration to just take another look at this last week. So I'm calling the meeting to order, and I would entertain a motion to approve tonight's agenda.
Mr. President, I move that
Yes.
the board approve the October 19th, 2020 agenda.
Is there a second?
Second.
Any questions or comments?
Mr. President,
Yes.
I would like to try to amend the motion to consider primary as well.
All right, there's a motion to amend the agenda to have another agenda item to discuss the issue we settled last week. I'll entertain a second on that, but that was not properly noticed, given notice that we would have discussion other than this one item. But is there a second on the motion to amend?
Mr. President,
Yes,
Mr. President,
yes. Mr.
I
Toth.
will second that. I second the motion.
Is there any questions or comments on the motion to amend? I would just mention that our council has mentioned to us before that we need to be careful about amending the agenda when we haven't given proper notice of what we're going to be discussing. But on the motion to motion to amend, we'll vote. All those, we'll vote. Mr. Burton,
Yes.
Ms. Tittle,
No,
myself, no. Ms. Plank,
Mr. President, I've lost you for some way. Can you hear me?
I can hear you. Can you all hear me?
Yes.
Yeah, I lost you just a little bit there.
I think it's your connection because everybody else says they can hear me. So, all right, Ms. Plank, on the motion to amend.
No.
Mr. Lander,
Hello.
No.
Mr. Tody. Rick, give us a thumbs up or thumbs down on the motion to amend.
I'm not getting anything. Hello.
Ms. Salisbury,
yes.
Oh, boy.
okay. Well, the motion to amend fails, but we'll give a couple of seconds, Mr. Tody, if you want to try and reconnect.
Did you take a vote? I can't hear you. Did you take a vote? Okay, I was unable to vote. Something's wrong here.
I'm counting you as a yes vote, and the motion fails 4-3. Okay. Well, so there's a motion and a second to approve tonight's agenda. All those in favor say aye.
Aye.
All opposed say no.
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 All right. And the agenda is approved. All right. I will call on Dr. Markley first to begin the discussion of the secondary reopening plan.
Thank you, Mr. President. Can we call up Rachel? Are you still running the controls? Have you given those over to Dr. Mixon or Dr. Huff?
I have the controls.
Okay, Melissa.
It'd be best to go ahead and, for the presentation though, to do the version
Yes.
of the PDF.
Yeah, let's go ahead and pull that up.
Would you like for me to share the PDF, or does somebody have a copy that they would like to share and run?
No, we don't want to run the PDF. Well, I want to run the version in Drive.
Okay.
Now let's run the Drive version. Last week during this time, we had a regular meeting and we came to the board with recommendations for starting school for the elementary pre-K through 5 students on October the 26th. The board approved that. And then the board did not approve the recommendations to keep secondary 6 through 12 virtual through the remainder of the first semester. And the board asked us to go back and look and see what we could do to get students in class based on the county guidelines of how many students we could have in and safely social distance, all the mitigation strategies that we have in place. And we have done that. And right now we want to walk you through what that would look like and the timelines that we would need to get that going if that's what the board decides to do tonight. Dr. Huff and Dr. Mixon are going to walk us through that and see what those scenarios would look like. Dr. Huff?
Good evening, everybody. We're actually going to start off with an overview of elementary because we figured you might have some questions about just where we're at with that. So we've got a couple slides that Dr. Moore is going to lead us through. And then the majority of the presentation tonight, Dr. Hux and Dr. Mixon are going to walk us through that. So if we can go ahead and get the presentation going, we'll let Dr. Moore go ahead and do the first couple slides there.
Are you guys going to share the slides?
I thought Melissa, are you going to put that up?
I don't have that current version.
If if you want to give me
I
control,
will grab it. Somebody just emailed it to me, so I should be able.
there you
Or
go.
you have the right to share.
Well, let's go ahead and do it your way. It's easier probably for you to do it.
And it's coming up. Do you see it now?
Got it.
Yeah.
Go ahead and go to that second slide and Dr. Moore can get started there.
Good evening, everybody. First of all, I want to thank the principals for collaborating and strategic planning to be able to make it possible to create strategies as well as systems for us to be able to get 100% of 100 students who require a person back in the classroom. I want to thank the specialists also for returning to the classroom to help us to achieve that, to lower the class sizes. And although it's not listed on there, I want to thank the Board of Education for approving at our last meeting to be able to us to have the students 100% in person who requested it back at school. And here's just a chart here. First of all, just FYI, and we told this share this last time, the class sizes that meets DESE guidelines, and you can look at those. I won't go through each one of those. Thank you. The elementary update, in-person learning before October 12th, we had 1,924 students, 55% of students requested in-person learning, and virtual before October 12th was 1,441, 45%. After you approved us to reopen, we opened a window for 3 days for parents to make changes. And as a result of those changes, you see 369 parents made changes, which basically changed the in-person to 60% and virtual 40%. And then you see where 49 parents requested to change from to virtual from in person. In order to satisfy this, we were able to do this by there are no students have teachers in the different schools. We in person, we were able to accommodate the number of people who requested in person. But in order to do this, we will have 116 students across the district who may have a virtual teacher from another school. And in order to make this happen, 18 of our 20 specialists had to be used in order to go back to the classroom to provide us these numbers. 5 of those are virtual and 13 of those in person. As much as possible, we were able to assign those in their home building, but in some cases, they had to possibly teach maybe virtual or in person at another school in order for us to be able to achieve these numbers. Are there any questions for me?
Yeah, Dr. Moore, from my math, we have 386 more students after the 12th. Are those new enrollments, or why the difference in numbers? Are they?
You mean the base?
If I add the in-person learning before October 12th and the virtual learning before October 12th, and then I add the in-person learning current and virtual learning current, there's a difference of plus 386 students.
Well, those, so that 369 may be off. And I think that would be either parents who requested, but what I don't have, because we haven't made the updates since this K-12, we definitely were still having some parents who enrolled during that time as well. And I don't have those specific numbers, but I can get those numbers for you.
I think.
Thank you.
Dr. Moore,
Yes, ma'am.
I have a question about the specialists.
Okay.
Could I ask it now?
Sure.
Okay. That when you say specialists, that's the reading and math Title I teachers, correct?
Yes, ma'am.
Okay. So they're going to be going into the classroom, or you said 5 of them will be virtual. And will they also be responsible still for their Title I class load?
No, ma'am. During this time, they will be responsible only for their classroom, but with the smaller numbers, they should still be able to work with smaller groups of students, but only their classroom.
So the Title I classes are essentially on hold for now, I guess.
The small groups.
Small groups.
Yes, ma'am.
Okay. All right. Just thank you.
Dr. Moore,
Yes.
how many students will be virtual K through 5?
The exact number probably would be, if I was to add those two numbers, 1,458.
And are they in that 3-day period? Is this when they have to decide for the rest of the school year, or they get to make that decision later?
They were asked to make this decision for the rest of the school year. However, we really do try to accommodate parents on a case-by-case basis when we can.
Okay. And is there going to be any changes to their schedule and instruction right now?
Yeah. Yes. Basically, we'll be sending a letter out tonight. But basically, the virtual students' schedule will mirror the in-person schedule and vice versa. It'll be the same schedule because we still have, special teachers, art, music, PE, ELD, special education situations. So it will have the same schedule. So their start time, early school, it will start at 8:30 and get out at 3:35. If they're in late school, they would start at 9:05 and get out at 4:10. But the schedule will be the same. Yes, sir.
So are they doing the same amount of time right now?
Yes, they will. No, I'm sorry, your question. When you say right now, what do you mean?
How many hours are the virtual students doing right now in K through 5?
They're doing starting at 8:30 and goes to 3:05, and then a virtual. So it's a little bit more time during the day now.
Okay.
Any other questions? Thank you, Andrea. You're muted, Andrea.
I think Dr. Hux is going to speak to these next few slides.
No, I wasn't planning on speaking to this one or the next one. Dr. Huff, maybe was that you who wanted to talk about these?
Yeah, sure. We can go ahead and talk about that. We had extensive discussion this last Monday about a dashboard showing the different data that we have, the data points that we have for staff and students that are COVID positive or are part of have gone into quarantine. And so we have this link to the this district dashboard that's there on the page, and we weren't planning on. Well, I guess we could go ahead and open that up, Melissa, and give them a little look, peek, see what that looks like. It's just the introduction of what this dashboard is, giving you some of the parameters about what the numbers are saying, and then we've got the numbers down here. And we created this data dashboard. There's a lot of discussion about what the denominator was going to be in some of this data. Are we including everybody in the district? Are we including just the students who are actually in person? We actually are mirroring this with what other districts are doing, and they're counting all of their students in that data. That data set, and because there are all kinds of different times when students interact with each other. If they're in the middle school right now and they might be in an activity or whatever. So at any rate, that's what we gave on that district summary down below, and we hope that is giving the sort of data that the board is interested in and our public is interested. We really are striving to be very transparent in those who are quarantined and those who are tested positive.
Dr. Hux, is that Dr. Hux or Dr. Huff?
Yeah, Huff.
Yeah, my system's not working well. I can't tell who's speaking, but would it be asking too much if we had if we could put a graph, an XY graph here and time and incidences so that we can see kind of like what they do at Jackson County. We can see whether a number is growing or declining or static. Would it be too much to ask for that?
Well, I'd have to defer to Melissa and to Danielle because what we have right now is a live data set. It's linked directly to a Google Sheet. And so as our staff update those numbers, they're updated automatically on the website. The software that drives the kind of data set that the Jackson County has is beyond what we have. And while we could do something like that, I believe, if I'm not mistaken, Melissa or Danielle, we had priced some of those things out, and it's rather expensive to have those sorts of tools on our data. So
that would be correct. It would be a separate system that would do that. And it would cost significantly. I think one system we were looking at was about a $25,000 startup fee. And so the dashboard that we have, I was able to create without any additional cost.
That's fine, but I wonder if it'd be a challenge to do one manually. I'm sure someone has the capacity to do that within the district. I appreciate the cost, but the trend is what I think we're trying to examine and monitor.
If Melissa, if we were to put those graphs in, would it have to be that like at the end of a data set? Like what I'm trying to say is on a Tuesday, from Tuesday to Monday of a given week, here's where can we do it that way and show, or do we have to pick out a certain amount, a set in time?
That would be, in order to have a graph displayed correctly, it would be a manual process from us. So if we updated it weekly, somebody would have to go in and update that weekly. Yeah, there's other ways that we can provide some of that data. And we can talk about other ways to do that without having a 14-day rolling average graph to still see trends.
Yeah, I mean, a static data presentation is useful, but a trend, a graph that shows trends is really information. And I think that's, we got a lot of numbers on the page. I'm not sure what that means in relationship to last week or next week or so on, but I do know that many of the other districts do have the graphs. So I just ask you to think about that.
You can definitely think about that and take a look at what, mock up some stuff over the next week or so, and you'll see what that might look like.
Okay, good.
And again, our goal is to be transparent. We want to offer the best data possible.
Okay, good.
Okay. Next slide. So another question that came up was about, whatever became of the matrix. Was, what are we using for data as far as, what our community is showing? And we've been using the Jackson County data, and to Jackson County's credit, they have done a better and better job as the time has moved along. They've partnered with us nicely and have given some charts that are very useful. And so Melissa, if you go ahead and open up that Jackson County website, we're going to show you the live data that we are using as of today. I had mentioned last week that the data that we're taking a look at is multifaceted. And if you look on the left side over there where it says school gating criteria, this is actually what they're using for their matrix, is this gating criteria. And the first thing is the number of new cases per 100,000 that they look at. And that graph is on the upper right, that new cases per 100,000 over the 14-day period. And you can see that it peaked somewhere around August and has been dropping pretty nicely since then. But as with some of the other graphs, you'll see that it's dropped to a low about the time we met last week. And since then, it's been steadily climbing again. And it hasn't climbed up to near where the peaks were, but it is trending up. And we don't know if that trend is going to continue or not. The second criteria is the trend in new cases. For the past 100 or for the per 100,000 for the past 14 days, that trend is also moving up, and so that actually was in the green when we met last time because the trend was dropping. But now that trend is starting to turn around. It might actually be flat right now because it's a 14-day trend, but it's certainly moving in the direction we'd rather it not move. And then, that 14-day percent positive graph is on the lower left. And, that's where we're getting that data from that's showing that increase over the last several days. And then the last thing is the ability for the school to implement mitigation measures. And that's things like consistent use of masks, social distancing, hand hygiene, cleaning and disinfecting, and contact tracing in collaboration with the local health department. And we are obviously doing all of those things, and those are all very important to us. So these are all these four criteria are and I skipped over it. I already said number 4, the percent of persons testing positive for the last 14 days. Those 4 criteria are the gating criteria that Jackson County looks at. And of those criteria, and then we also, they throw this other one in here too, the use of hospital beds. We're actually in the green for that use of hospital beds. That's this secondary gating criteria that's down below. We're in the green there, and pretty solidly in the green. But the other criteria, we're in the red on the 14-day, 14 average percent positive in the 100,000 cases, new cases per 100,000. We're in the red and trending away from where we should be. So anyway, that's where we're at. Any questions on the gating criteria?
Yeah, Dr. Huff, I sent you an article from the Kansas City Star, I believe late last week, where they said on the front page that the Kansas City area was running short of hospital beds. When I saw this graph, I thought that's interesting. It sure doesn't square with what the Star presented.
Well, keep in mind,
did you follow up on that?
Yeah, I didn't follow up specifically, but do keep in mind that it's not unusual in any year for hospital beds to run short. As a matter of fact, it's not unusual for hospitals to divert ambulances away from hospitals that are maybe full on beds. The criteria here is talking about the percent of beds that are used by COVID patients. Of course, there's lots of beds used by non-COVID patients. And as we get into the flu season, that's only going to increase as well. And so I don't know that it's more pertinent to have overall hospital bed usage, but this is really focusing on the impact of COVID-19 on the hospital system. And according to Jackson County Health Department, at this point in time, COVID is not a great draw on the overall beds in Kansas City.
Okay.
All right. Now, I believe Dr. Hux.
Thank you, Dr. Huff. Sorry about any confusion there. We've talked about the layers of mitigation in past meetings at length, but because we're discussing a return, I wanted to have this slide here just to remind everyone of the various categories. Happily entertain any questions, but give you an example. With cleaning, for example, additional cleaning would take place. We have purchased and have in hand electrostatic sprayers, for example, and that cleaning is not just limited to the classroom. It'll be done on school buses as well, in between each tier, for example. Like health checks, there's a lot of aspects to health checks, but one of the things that the reopening committee thought we should do and the board approved was to buy temperature checking devices, and those have been purchased, and we've obtained all those and installed those as well. So those are, like I said, there's the 20 layers we've talked about on numerous occasions. If you have any questions, be happy to answer any of those.
Yeah, I have a couple questions. I can't see if anybody else is wanting to, if they're raising their hand, but so I'll try. Yeah, there are three on this list that that I think we always should be asking the questions, and maybe there's two on the list and one that's not. The first one is social distancing. And I read the plan again today, and the plan says we start with 6 feet. And then we, if we can't do 6 feet, then we go to 3 feet. And it's kind of a best efforts sort of plan. Are you confident that going from 6 feet to 3 feet is not an unreasonable risk for our students who will be going back the elementary, for example? Are you confident of that? And why are you?
Take the recommendations that are given, and that one was recommended by the Department of Elementary and Secondary Education, as well as Children's Mercy Hospital. So, not being a medical expert or even a virus expert, that would be my response, Mr. Tody.
Well, I know that you have responsibility, as Dr. Markley indicated previously, for research. Ongoing research into the COVID. Have in your work and the researching the various publications, have you seen anything that would say that 3 feet is it increases the risk substantially where we should have some concern?
I've not seen anything to delineate the difference between 3 feet and 6 feet. 6 feet would be ideal. That's the number that CDC uses, for example. And I would note also that if children are within the 3 feet that we're having in a classroom as a possibility, and someone does test positive, or there's some quarantining and that sort of thing, the aspect of those within 6 feet and 15 cumulative minutes over 48-hour period that 6 feet number would still apply, not the 3 feet number. So for what it's worth, I mentioned that.
Are you confident there are no exceptions to the 3 feet rule?
There's no exceptions that I've noticed or read about by Children's Mercy or Department of Elementary Secondary
No.
Education guidelines.
I didn't say that right. Are you confident that there are no violations of the 3 feet rule? That you have a protocol to make certain that there will be no violations of the 3 feet rule as we open the schools to elementary kids? And if so, why are you confident?
Well, building administrators have been going around to the classrooms with yardsticks and looking at classroom setups and that sort of thing. The building administrator, in efforts that they do on a daily basis, will be holding people accountable, whether that's staff members or students, to make sure that the rules are followed.
Okay, then I moved to ventilation. We authorized an assessment for $80,000 6 weeks ago. We're about to open the building. What do we know? What do we know about the ventilation?
Sure. Well, as you know, that study is taking a period of time, and it's not completed at this time, but they have been to each building, and we've actually found some positives. For example, some of our buildings do have hallway ventilation. Give you an example: Little Blue, 3 Trails, New Trails, and then parts of pretty much all the other buildings also have some hallway ventilation. Could be very little, but they do have some. And then something else that they've been finding are these what are called transfer ducts, which are basically, it's a duct that runs from a classroom over the ceiling, or through the ceiling over the hallway wall into the corridor. And when you pressurize the classroom with the HVAC, it'll push that ventilation into the hallway. So those are some of the things we're finding. We've been, as you know well, we've been looking through the lens of ASHRAE, and we've already implemented some of the things that ASHRAE would want a school district to do. For example, testing air quality, adding outside air dampers and filters, and trying to do MERV 13 filters, for example, and that sort of thing. So regular maintenance and being proactive with the ventilation versus waiting for a work order to come in, but creating a proactive schedule, to checking the systems and that sort of thing. So those are all in the plan with regards to the ventilation mitigation.
I would suggest, though, that you take a look at the document, because the document says that there are no known issues that have come out of the ventilation assessment. That it appears to me there are some issues.
There is no assessment yet, Mr. Tody. And
no, I didn't. Wait, let me finish my question, please. The draft plan said, reopening plan said there are no known issues that have come out of the assessment. Now, what I think, for the benefit of the parents and the teachers who read that, in all fairness, there have been issues, but we have found adequate remedies to this point. Is that fair to say? I mean, you've already listed several of them. I think people need to know that there are issues, and that we have taken remedies to deal with those. Now, is that a fair statement?
I can tell you, I don't agree with that statement.
You know what?
I do not agree with that statement. We've had this ventilation system in for the last 20 plus years. Again, a ventilation issue would have to be identified. This system's been, functional for the last 20 years.
Well, I'm not going to belabor the point, but I'm really trying to make certain that when people read that plan, that they can understand, rather than reading three large words, no known issues, that they can understand the risk that they might be taking. And I would just caution you to use some judgment in what you say in writing in that plan, so people have the ability to make a decision about whether to send their child back to school and whether to send their teacher, whether the teacher will go back in the classroom. And that's just a word of caution. Moving on to the PCOs, where are we on the PCOs?
PCOs have been determined for placement and ordered, and they're in production. It's my understanding that the transport units are in production this week and should arrive next week, and they can be quickly installed for the buses. The units for corridors will come later, probably in a couple of months.
Okay. So we'll have the assessment on ventilation next month?
It is due to be completed in November.
Okay, thank you. No more questions.
All right.
I have a question, Dr. Hooks.
Yes, sir.
I noticed that there's no testing, COVID testing listed on the, as far as guidelines. Is there any, because I know that there was some mention in our last meeting that there was some funding or some testing that might be provided. Is there something we can start thinking about, at least promoting that that we get, and how, once we have these positive cases, are they required to get testing before they come back? Or, I mean, for us ones on quarantine, how does that work?
Is Shirley Early available to move in, or Melissa Tanner? And they can answer both your questions with regard to potential testing. They did go to a webinar, I believe it was last week, and look at that. And I believe we are applying for PCR kits and still in what I would call early stages of development of a potential plan. It would involve probably hiring of additional nurses and that sort of thing. So is Melissa Tanner or Miss Early available to speak to that?
Can you hear me?
There's Miss Tanner. Thank you, Miss Tanner. Sorry to.
No, it's okay. Yeah, so the state has offered for school districts an antigen test in which they are going to allow us to apply for. We have done the research, we have looked into it. We are going to recommend that we get the antigen test to do staff for now. We are looking into how we are going to manage to test our staff. Right now, that's the next task we're looking into. We're going to have to look for some resources for having nurses and a location to make sure that happens. In regard to testing, once a staff member has tested positive, they no longer have to have a test to return back to work. The CDC guidelines are you can return back to school or work 10 days after symptom onset. You remain fever-free for 24 hours and you have an improvement in symptoms. So as long as they meet all criteria, they are allowed to come back to school or work on day 11 after their COVID illness.
On day 11? What about students?
Coming back to school?
Yes.
That's the same. So staff or students, it is day 11 after a positive test.
Okay.
As long as they meet the criteria that they remain fever-free for 24 hours and their symptoms, they have improvement of symptoms. You no longer have to have symptoms gone. Some of the symptoms are lingering. So the CDC does say as long as there is symptom improvement, they may return back to work or school.
Okay, so is there any time frame we're looking at? Do we have any idea when those things might be available to the students? Because I thought the staff was being able to be tested at our own clinic, the ones with benefits.
So I know that our care here does have some tests to do employees. I'm not sure how often those are being utilized. In regards to the students, it's a big task for the undertaking of the health service department. At this time, we just do not have the resources to provide that to all the students. We would need a third location in each school. We would need running water in that location. We would need additional staff to help administer those tests. So as of this time, it's just not something that we have the resources to be able to provide to those families. But hopefully in the future, it could be something that we could look into again as we have more resources available to us.
It'd be nice for us to know what resources are needed and what we're lacking and what those costs would be now, and to know how soon we could possibly be available. And also, I think as a board and a district, we ought to look at what we can do in the meantime, and once those things occur, to be able to provide that to our, because I understand that Jackson County offers one free test.
They do. There are, Jackson County sends out, which all of our nurses have resources to. They do daily testing that is free. You just have to sign up and you can go to that. They do multiple locations. They're at a different location every day, Monday through Friday, but that is available. And then there's also Truman Medical Center. That is another resource that will work with families to provide testing for families as they need it.
I don't know if anybody can answer this that would know, but since there are being tests offered that are free, would it be wise for the district to promote those students that are going back in person to get that test as a part of coming back in person?
They
So
are.
as of, oh,
Go ahead,
sorry.
Melissa. Go ahead.
As of now, it is not, the health departments have not stated that we need to recommend testing for all students coming back to school. We have asked in the past, and as of now, and that still remains something that they are not recommending to happen prior to coming back to the school setting.
Do you have any idea why they're not recommending that?
It's pretty invasive for the kiddos. I will tell you, there are a lot of pediatricians in the pediatric population who are not even testing the smaller kiddos. It's a pretty traumatic experience to have the tests done. They have to go pretty far up in the back of the nasal cavity, and it's pretty uncomfortable for the kids. So I do know a lot of the pediatricians, if you are presenting with symptoms, since your treatment would not be any different whether you're positive for COVID or not. If you are presenting with symptoms and they are saying, I think you have COVID, they are just having those kiddos quarantine for the 10 days, and they are not recommending a test on all children.
What about our secondary students?
So secondary kids are probably getting tested more frequently because 10 to 17 age range is showing a higher risk of transmission and having COVID. They're kind of presenting like adults are now. So they do present a little bit more, and the pediatricians are recommending that they do get tested more frequently than a smaller child will. But then it's also based on recommendations of the pediatrician. So not every child is.
Okay. So that's something we wouldn't promote to our families to have that test done. I'm thinking instead of quarantining people who may not have any, they're presenting some type of symptom, rather than if they got tested, we would know for sure.
So with the
maybe.
antigen test that is offered, it is just an antigen test. So it's doing a quick test to see if you have any antigen virus COVID antigens in your system. Even with a negative antigen test, it would not necessarily mean you do not have COVID and you are allowed to go back to school. If you present with high risk symptoms of COVID, cough, shortness of breath, loss of taste or smell, and you have a negative antigen test, it is recommended that you remain in quarantine and go home and are followed up by a primary care provider to receive a PCR test, which is done at a laboratory to get a definitive confirmation of COVID or no COVID. You can get false negatives on the antigen test, and that is why a negative antigen test would not automatically allow someone to go back into the school setting.
The cases that we have right now, are those positive test results, or those are presented symptoms?
So we have positive cases right now. We have people who are out with symptoms. We have people who are out quarantined due to being exposed to a COVID case.
And when they get tested, that's on their own.
Yes, when they get tested, they're on their own. Anybody who is exposed to a positive COVID case and has to quarantine for 14 days, a negative COVID test will not get you out of quarantine. So if you go and get tested, or if you antibody test and it is negative, they have to stay in quarantine those full 14 days.
Okay. So my last question is there any time frame that when it comes to the testing kits we may get and all that, do you know? I may have missed the answer to that.
So I know we have to have it filled out this week for the staff that we were going to at least get our application in. The application deadline is on the 21st, or I believe. So we were going to go ahead and get that application submitted so that we could get that process going with our staff, and hopefully allowing some of our staff to get tested to keep them in school so that they can teach our kiddos.
Thank you.
Mm-hmm.
Right, good, thank you. Are we going to move on now to the actual secondary information about the secondary plan?
You bet. We can definitely do that. This is just here to note, for what it's worth, the reopening committee meets weekly on Tuesdays, and this is on here just to let you know that the recommendations put forth last Monday remain unchanged for that group. You can go to the next slide. All right, Dr. Mixon.
Good evening, everyone. We wanted to start off with providing you some options for our secondary students, and just give you some information about where we are currently with our virtual learning. With our virtual learning at the secondary level, we assign what we call weekly virtual attendance points. And those points are a combination of students attending synchronous lessons and doing asynchronous activities. And so what we're seeing is really 82% at the high school level and 83% at the middle school level of students getting on, participating in classes, doing their lessons, that sort of thing. What we are noticing is a higher percentage of D's and F's with students currently. We had our first trimester end middle of last week, so we did see an increase in the lower grades as compared to this time last year. So those are things that we're working on individually and with students in buildings. Our administrators and teachers are looking at those grades and seeing what we can do to mitigate some of those lower grades. I also do want to make a point that Trister grades are cumulative, meaning that we don't stop at Trister. So Trister 1 gets added to Trister 2 and Trister 3. And so it combines, throughout the semester. So there's plenty of time for students to be able to improve those grades before the end of the semester.
Dr. Mixon,
Yes.
do we know if other districts are seeing an increase in their Ds and Fs, and to what degree?
We do,
Across
and
the
I would
state?
say yes. I would say that what we have found out is that is pretty consistent across the board with all schools, even ones that are not that are participating in hybrid and different types of virtual learning, because we have reached out to other districts and gotten that information. So it's pretty consistent.
Dr. Mixon?
Yes.
Okay, on the percentage of Ds and Fs, is there a way, or are you getting from the teachers that this increase is due to not turning in work, or is it just missed assignments, or is it not understanding, or what is the most cause of that, or do you know?
I would venture a guess that it's probably a little bit of everything. The way our schedule is working right now, in the mornings, the students participate in synchronous activities. So they get on with that. We are on a block schedule in the mornings. And so they do 4 classes a day and get on Zoom sessions with their teachers and do various lessons. The afternoon sessions are devoted to individual group work. Students get on with teachers for extra help. So it's a little bit of all of those things, Ms. Tittle, that you just mentioned. So, we're, like I said, we're working in the afternoons for intervention to work with students to improve those grades.
Okay.
Okay, next slide, please. We also wanted to look at other neighboring districts to see what they were looking at and what they're doing currently with their virtual learning and their plans to reopen. And what we have found was that we have Independence, for example, is doing a hybrid session. They open early on. Their hybrid looks a little bit different. They do an A and B week. So students come for an entire week and then are off and do virtual the following week, and then it rotates through. Their pre-K through 5 is in person, and then grades 6 through 12 are on a hybrid. They did bring their seniors back at 100% recently. Grandview has just recently returned K-5 in person. They're 6 through 8. We have found that they're returning on a hybrid on 10/26. Their high school is still virtual. And Blue Springs, we have found that they're 100% in person. They have about 80% of their students attending in-person classes, 20% virtual. And then Hickman Mills, Kansas City, and Center are all participating in virtual instruction. I know that Center is looking at potentially bringing their elementary students back soon, but they're all virtual at this point. Lee Summit is pre-K through 3 in person, and then their 4 through 12 is currently on a hybrid. And they do the AB hybrid that we're going to talk about in just a few minutes. We have several students who go to Summit Tech. Summit Tech is operating on this AB hybrid, with A days being Monday, Tuesday, and then Thursday, Friday being the B days. Wednesday would be a virtual day. And that's what we're doing with our Herndon students when we bring them back on the 26th. Middle school enrollment currently, we wanted to talk about this a little bit. Currently, we're seeing anywhere from 46 to 54% of our students at the middle school level have requested virtual learning, so doing online learning. Now, what we noticed last week was when we put out there to the elementary parents to make a choice and to make a change and whether they wanted in-person or virtual, what we saw was about 14% of the families did change and move to in-person. So along those lines, if we were to do that, if we were to see the same type of increase at the secondary level with the 14% increase to in-person, we would then see anywhere from 60 to 64% of our students attending in person. We're planning on opening that up again tomorrow, and then we would ask families to make that choice for the rest of the school year. So whether they want it to be virtual or in person for the rest of the school year. At the high school level, next slide, please. We're seeing fairly similar information. And in that we have 41 to 47% of our students are wanting to stay virtual at the moment. Again, with a 14% increase, we would see anywhere from 67 to 73% of our students wanting to return to in-person education if we were to open that back up. So what we have discussed as far as a hybrid option, an AB option, similar to what we're doing with Herndon, A days would be Monday and Tuesday, B days would be Thursday and Friday. Our Wednesday would be an all virtual day. Teachers would have the opportunity to check in with virtual students, would check in with their all of the students. It also gives our custodians an opportunity for some deep cleaning in the evening. With that hybrid instruction, like I said, we're doing something similar, planning on doing that at Herndon. With our middle and high school kids, in order for that to take place, it would take several weeks to get transportation ready. If we allow folks to make a change starting tomorrow and leave that open for 3 days, 2 weeks from that close date would put us at the end of the first week of November. So we could potentially start with a November 9th start. If we were to do that, that would give us 18 days for A students to attend this semester, and 14 days students would attend on the B day. So there's a little bit of discrepancy, obviously, because we've got holidays coming up, Thanksgiving and the winter holiday, Christmas holiday coming up, that would those days would be off balance. On non-attendance days, if they're an A-day student on non-attendance days, they would log in. They could either log into Live Classroom or they could log into Google and do asynchronous lessons. One thing that will definitely occur with these hybrid teaching options is that we will have to have concurrent classes. Currently, we have not separated out our virtual and our in-person classes. So teachers would likely have students that are in their classroom that are virtual only. They would have A-day students and B-day students. So the concurrent teaching that we've been talking about they would be teaching multiple groups of kids online on Zoom at one time. The last thing is we would have to do some pretty significant schedule changes. We would not have the half day or the hybrid block schedule like we currently have. We would go back to the regular 7-period day. I believe Dr. Hux, were you going to speak about transportation?
Yes, Kevin Easley, if he's not moved in, I will definitely be able to speak in more depth to this.
Dr. Hux?
Yes, sir.
I had a question before she started. You said that the recommendation remains unchanged from last week. Is that the same? Is that speaking for Ray Team as well?
Ray Team doesn't meet weekly. It's my understanding that they have not met since, so I can't answer that. I'm not a member of Ray Team.
The purpose, well, I know that they made the presentation last week, and the reason I asked is I remember Mr. Weiss saying that given the information we have current, that he don't know if that would be the same recommendation at that time. So I was wondering if there might be a change in that at this time.
Yeah, again, I don't believe
you mentioned.
Dr. DeVilbiss might be able to answer that.
Mr. Burton, we don't have any information other than what Ray Team gave us at the last meeting that there's any change in the recommendation.
All right. Well, the last thing that he mentioned was that he didn't know even at that time if he would still make that same recommendation based on.
I think he was speaking for himself in that context.
Okay.
All right. Did Kevin Easley get moved over? Kevin's in here.
Yeah, I'm in here.
we definitely want you to be aware of, the transportation piece. Sometimes, unfortunately, it's the tail that can wag the dog, as they say, or used to say 100 years ago, maybe. So, Mr. Easley, would you like to discuss these topics?
Absolutely. Good evening, everyone. I'd like to tell you that we currently have the K-5 SPED, RSA, Herndon Career Center folks that have been approved to return. We're working through routing those. We've built the system that will allow us to transport the nearly 1,700 students. To accommodate the elementary request, the changes in request that we had last week, we are going to have to move the parent responsibility zone out from a half a mile to 1 mile. That will allow us to meet the restrictions for seating on the bus. Adding middle and high school will make some changes. We currently have students attending school en routes during those times, so we'll not only have to create the routes for the new students, we'll also have to move the students that are currently attending there to a different tier. So we would like to give notice to those families if we're changing their schedules. It's an extensive update or change to our routing software, and it would take a while to establish, especially if we want it done right. In regards to the COVID safety protocols, we are requiring masks. We're limiting ridership to 1 student per seat. And as Dr. Huck said earlier, we'll be cleaning between each tier. For anyone that doesn't know, we do 4 tiers per day. So we would clean the bus after we drop the first set of students off before we go get the next students. Do that each time, and then do a thorough clean at the end before they leave at the end of their shift.
Any questions? Thank you.
Oh, no, I had a question.
Oh, go ahead, Ms. Tittle.
Yes,
Okay.
ma'am.
Okay, Kevin, on this parent responsibility zone moving from 0.5 to 1.0 miles. Okay, that starts next week with elementary, correct? When
Yes,
they
ma'am.
start. Okay. And does that include all elementary schools? And
Yes, ma'am.
okay, all right, thank you.
All right, thank you.
There's some additional things to consider as we discuss different options for opening secondary buildings. Last time we talked about, do we need to keep the same schedule or the same criteria open for middle and high schools? And we do have traveling teachers that operate between middle and high schools. Mostly it's music teachers. And we did discuss there would be a way for us to operate on different schedules with those music teachers. We might have to change some of the virtual learning slightly with advisory, possibly moving advisory to earlier in the day on the B day. But it is something that we feel like that we could manage. We also wanted to make sure that everyone knew that, there will likely be some schedule changes with students as we're trying to change so that the virtual students are in their own class, and then our AB in-person kids would be in their own class. Even with that, on the AB schedule, we will likely work to balance some of those and do some schedule changes as well to try to make sure that we are not exceeding the maximum capacity in the classrooms. We wanted to just remind everybody that third trimester starts November 30th and that we are going to end first semester on January 15th. And that we will open the options up to parents again tomorrow, with that choice being due on the 23rd. So parents can go back in and change their in-person or virtual option. And then that, whatever they choose at that point, will be what we look at for the rest of the school year. And just, a couple of other things to consider. We have a few potentially what they call super spreader events coming up soon, as far as Halloween, Thanksgiving, Christmas, and New Year's. So we know that when kids and everybody gets around in large groups, those are potentially what they call those super spreader events. And we also have several staff members that have requested various accommodation plans or the Family First Coronavirus Act that allows for staff members and for employees to stay home because their children's daycare or school is not open. So we have several staff members that are on accommodation plans or have medical accommodations that we have been able to accommodate to this point. Once we return to in-person, we are not confident that we can continue to accommodate those requests. We are not able to completely separate out virtual instruction at the secondary level. We have looked at it and would be potentially able to provide some classes virtually to some teachers, but it would most likely be a few in-person classes and a few virtual classes. So we wanted to make sure everyone was aware of that. So ultimately, we have three options that we've kind of alluded to and discussed a little bit before. We have the 100% option that we would say everyone would return back at the middle school level at 100%. Our maximum class sizes would at this point look to be 17 to 20, but once we separate out those virtual students and so that we have in-person students in different classes than virtual students, those numbers are likely to go higher. At 100% model, we would not be able to social distance at the secondary level. Some other additional considerations that we think about at the secondary level that we don't necessarily have the same level as elementary: hall passing time. We have a lot of students that would be traveling through the halls, a lot of students in the cafeteria that we would try to manage. It would be more difficult. The other thing too, at the middle and high school level, the elementary level, our teachers typically see 20 or so students, and now probably even less, 15 to 20 students a day. Whereas at the secondary level, they're seeing anywhere upwards from 150 in a normal situation. The other situation would be the A-B hybrid that we talked about. The scheduling team at the middle school is currently working to pull out those virtual classes. They started that last week. They started that process. It's going to be a combination that there would be potentially all three middle schools would work together on that. So they may have a virtual teacher that might have students from all three schools. The in-person class sizes currently look to be at about 13 to 11 at the three middle schools. But again, those are likely going to go up when we pull those virtual students out and try to put them in their own class to lessen the number of concurrent classes that we're offering. As Kevin talked about a little bit earlier with the challenges for transportation and getting this all routed, we believe probably the earliest we could start would be November 9th. And again, then we would have 18 days of students attending on A days and 14 days on B days. And then the third option is to maintain the virtual learning environment that we have currently. And we do, as Ray team talked about, and our reopening committee, this would maintain the continuity in instruction as we have it currently. And then for our high school, yes, I'm sorry, go ahead.
Sorry, those 18 days and 14 days, that's through January 15th, correct?
Yes, ma'am.
Thank you.
I have a question.
Yes, ma'am.
So what hinders us from doing classes simultaneously, like virtual and in-person students at the same time? I mean, if they're in English, the virtual students and the in-person students that are taking an English class, why can't a teacher do that class simultaneously?
Well, one of the things, as a former teacher in the district, that would be really difficult. It would be challenging because you'd have anywhere from 10 to 15 kids in front of you, and it would be really hard to monitor the students that are online. And we feel like the instructional program that students would get in that situation would not be as powerful and would not get the quality of instruction that they're receiving now, because the students that are virtual on that day are not going to be getting the same level of instruction as the students that are in person. So it's going to be difficult for teachers and not as good for students.
Well, our students are already getting D's and F's, so how much worse can it get?
Well, like I said, I do believe this is at one point in time for those D's and F's, and that students we have the time to bring those up. Again, there's lots of different ways to look at this. I see the way our teachers are managing the morning sessions now, and they are working really hard to provide engaging activities for students, and then working with them in the afternoon, being able to give them some of that individual attention that they would not be able to do if we return to 7-hour days. And then they have some students online at home, and then 10, 15 kids in front of them every day.
Ms. Salisbury, can I just kind of speak to that? As a student, I have a hybrid class where we go in one day a week and we are online one day a week. And I know from my point of view, I'm a pretty decent student, and it is not the same quality as our in-person or my 100% virtual. I see a marked difference in it because as I'm online, the teacher has her back to us. And so it takes somebody in the classroom to point out that we have a question that's popped up or a comment. And so just from a student's point of view, I agree that it is not near the level as if we did 100% in person or 100% in virtual. That's just my thoughts.
Well, I appreciate that, Beth. I just happen to disagree because I think that part of that is a lack of instruction for the teacher. If she has her back and she knows that she has a virtual class also, then she has to be trained, or she has to be instructed, or she has to have the mental focus on the fact that she has a divided class and to teach from that perspective. I just think some of this is we're making it sound as though it's so hard to do these things, when in actuality, we haven't put it into practice. So we don't know how hard it is. We're saying from a data perspective, but not from an actual perspective. I know yours is actual, but I'm referring to the kids. My concern is that we have children that are failing, literally failing, and we tell ourselves that they're going to catch up, and we know they're not, but we say they are. And these kids are going to reap the repercussion of all of this that we're doing because of the fact that we can't do certain things when other districts are doing them.
Bobby, if I may, part of the issue to keep in mind too is that we are trying our best to provide the resources necessary for a teacher to be able to teach in this kind of environment. I will echo what Andrea says, though. It is not easy to teach in that way. It is great to be able to have 100% of your kids in class every day, 5 days a week. We believe that would be ideal. We believe that is the best teaching environment possible for our kids. That's why we advocated it for it so hard for our elementary kids. The problem we run into in secondary is that we would not be able to social distance with kids in there every day. And so again, we're just presenting all of the options to the board. And we feel it's important that you understand all the options from our perspective and from a teacher's perspective. But I will echo what Andrea said, that in the hybrid model, concurrent teaching is very difficult and not, it's not the same as having just a class full of kids in front of you or a class full of kids in the virtual environment. We will provide as much support as possible, but it will be difficult.
Dr. Mixon.
Yes, sir.
I'd like to understand just a little bit more about how it would look like, with what Mrs. Salisbury is asking. So if you have 15 kids in the class and 10 that are virtual, would the teacher be sitting at the desk in a Zoom meeting? So she would be seeing those kids on the Zoom screen and then trying to deal with the kids in the class, or do we have a separate camera in the classroom, or what would that actually look like?
We do have separate cameras. We have web cameras that we have purchased, and then we have the camera that would be on the teacher's laptop. So it would be a combination of both. The difficult thing would be, you would be able to videotape the teacher teaching the lesson. It would be really difficult to be able to see the students as you're teaching the lesson that are participating virtually. So we do have, several different things that we've purchased to try to help with this situation. But like I said, it would be difficult. We would also work with the teachers to see, do we offer asynchronous lessons to those students who are not in attendance that day? Do we open up the option for them? Obviously they could join classes through Zoom at any given time. And it may even come down to a difference between department levels. We have some schools that we've talked to where, some departments choose for their students to get on every day. Some departments give them asynchronous activities on their off days.
So you're saying the real issue is being able to pay attention to two different groups, an in-person group and a virtual group at the same time.
That is one of the issues, yes. Being able to provide the level of instruction that we need to provide to them.
Dr.
They
Nixon.
would be getting it. They would both groups would be getting the same instruction.
Potentially, they would be seeing the teacher present the lesson. Yes.
But you're saying the difference comes when they have questions or different things like that, or need one-on-one.
Yeah, things like classroom discussion that we're able to do with our in-person students. Obviously when in the time of COVID, we don't do a lot of partner work and things like that. But even, when we had summer school, we would have students working together as partners. They would be socially distanced, but they could still do some more of that type of activity in the classroom that our virtual students wouldn't necessarily be participating in.
Okay, thank you. That helps me understand better.
Dr. Nixon.
Mr. Burton?
I think, the question I think we should ask is, if we got these D's and F's, is 18 days and 14 days, A and B days, is that going to improve that situation? Changing right now? Or do you think, is that something we look at as a viable option to improve our grades, to change right now?
I can't really speak to that for sure. I don't know. I know that we know that students perform better when they have relationships with their teachers. And I think that, one of the things that we're seeing now with teachers are really doing some great things and making efforts to do that. It's just a difficult situation. If that, obviously we can't predict that, but it would be something we would look at, or continue to provide the intervention in the afternoon, work with small groups, potentially even look at schedule changes and things like that.
Because I noticed the only thing mentioned about virtual is the continuity in instruction. So that's something that we would be sacrificing.
If we go on to the high school, the last slide is our high school options. And again, they're similar as far as the numbers and that sort of thing. One of the other things on the virtual instruction that we do have some, we have students quarantined at the high schools at different times for athletics and that sort of thing. We also feel like our high school students are able to manage independent work a little bit better. As you can see in the number of Fs, we had a smaller increase in Fs for our high school students because they work better independently. The other thing that was a concern is just, substitutes when we have large numbers of teachers or students or that sort of thing that need to quarantine. There is a concern about subs in the district once we stop doing the virtual instruction. As far as the high school options, again, we're looking at our current in-person classes are, Raytown High is 22, about 20 at South High. We would have to look at doing something different for our performance classes like music and band and that sort of thing, because they have more numbers, they have larger numbers of kids than we could accommodate and being able to social distance. At the high school level, we are not going to be able to do anything with schedule changes. The high school schedule is very complex, and we are looking at trying to make some changes at semester to be able to separate out those virtual students, but it would be semester before we could possibly do that at the high school level. So all classes at the high school will be taught concurrently. As far as the AB hybrid at the high school level would be about 14 currently at Raytown High and 12 at South High. But again, once we pull those virtual students out and they're in their own class, then those numbers would increase. Again, looking at, the 18 A days, 14 B days. So that basically talks about all the different options that we have discussed as far as 100% the AB option and then remaining virtual. Any other questions?
Is there any room for improvement in our virtual instruction as far as lowering the number of Ds and Fs?
And again, I think, the Ds and Fs, that was the Twister grades are one point in time. And like I said, our teachers and our principals are working on those and working with students to help mitigate that. So yes, I would say definitely. And again, looking at that time that we have already built into the afternoons to work with kids individually on different grades and that sort of thing.
Dr. Mixon, sorry,
Yes,
Alonzo. Are we reaching out to the parents with those Ds and Fs and making sure they are working on meeting for parent-teacher conferences? And
Yes.
making that a priority next
Yes.
week?
Yes, we have had, teachers are calling home. We have administrators calling home. Our social workers are involved in this as well as our interventionists. So it's kind of a collaborative effort to work with families, so much as we have building assistant principals and counselors going on home visits to talk with folks that they haven't been able to get in touch with. So we feel like, it's going to take an effort at the building level, and they are willing to put in the effort to do what they can to help mitigate this.
Dr. Mixon?
Yes.
Something that came up in several of our excuse me, correspondences we've had this week from teachers, either by email or the Board of Education correspondence forms. Some teachers have referred to the fact that they're going to be returning to work at school next week, even if they're a secondary teacher. Is that what's happening? Is that what's going to happen?
Yes.
Are all teachers going to report and work back at the building? Even secondary teachers?
Yes. Yes, we have asked all teachers to. We also have, we have our STA, our Summit Tech students and our Herndon students, and they typically attend either mornings or afternoons at Herndon. So they will be in the buildings part of the time. So the time that they're not at Herndon, they will be in the buildings.
Okay, do teachers who teach virtually in elementary all work from the building, or do they have a choice right now to work from the building or from home?
I am going to have to defer to Dr. Moore on that, or Marlene. I am not certain on that.
At the last meeting, Ms. Tittle, we did inform the board that once we start back with all teachers on the 26th, or with elementary, teachers would be coming back into the building to teach, whether it be virtual or in person.
Okay, I didn't remember that, but that's elementary. But then the secondary teachers are the ones we've had a lot of correspondence with,
Right.
this past week. And several of them have mentioned that even if they are teaching virtually, they'll need to work at the building. Is that what
That's correct. That's correct.
Okay, can you explain why they do not have a choice, won't continue to have a choice?
We've asked all staff members to come back and teach on the 26th, to be present in their classrooms. We feel like that's, if we're going to bring the staff, a portion of the staff back, we bring all the staff back, except those that do have accommodations, whether it be childcare or health issues that they cannot come back, and Marlene has granted those.
So Dr. Markley,
Yes.
so before we entertain any kind of motion on what to do, and before we hear from the speakers who have to speak, I appreciate all this information that you guys have come up with. This is a lot of work that you guys did to come up with these options since we asked you to do this last week. So with the options given, what is the recommendation from the administration?
Well, let me first say thanks to our presenters tonight. Yes, they have been doing a lot of work, but we've been working on this, not just this week, but weeks previous, looking at all these scenarios. With what you heard tonight, with what we've seen in the news, the correspondence that we've had, I think our recommendation is going to stick with bringing the pre-K through 5 back to school starting on the 26th. And we'd recommend keeping 6 through 12 virtually through the end of the semester for a lot of the reasons that we've stated. One being the increase in cases and an upward trend, not only in our area, but also even within our own geographical boundaries. We're seeing more and more cases of our older students being quarantined or actually testing positive for COVID, along with kind of to Mr. Burton's comment about what's 18 days and 14 days going to get us. Really, we're that close to the semester with the holiday breaks in between. It would give us more time to hopefully come up with an even better plan of scheduling at the high school level, which is also, like Dr. Mixon mentioned, is very complex with students in the special classes that are taught all the way from the English 1 up to the composition classes individually. So we'd recommend that we stick with that recommendation to be virtually to the end of the semester in secondary.
Well, I've been one who, I mean, we all want the kids to be back in school, and I've been one wanting to look at this, bringing them back, but the presentation does show that there could be a lot of obstacles to doing that. So your recommendation is to stick with virtual for secondary for the rest of the first semester.
Correct.
Dr. Markley.
But in that time frame, we would still be looking at what we need to do to bring them back starting the second semester.
That's correct. And we can also begin to work on the master schedule and get it more succinct and moving forward in the second semester. And we'll also have some more time to look at trends and cases as well.
Because I think that was some of the confusion this time. And when we first started the semester virtual, people thought the whole semester was going to be virtual, and we always understood that we were going to take a look at this. So there was some confusion. So even if we go this route, their understanding is that we still want to be doing whatever we can to bring the kids back starting the second semester.
Yes.
Mr. Moore, can I make a comment?
Yes, Mr. Tody.
I support Dr. Markley's recommendation, but I also think that in doing so, there's some things that some actions I'd like to see or that might be taken. I want to go back to Bobby. I think she showed a lot of courage bringing up the issue of kids with Fs in the middle schools. I had no idea that the numbers were as staggering as they are, and I've used the word staggering. They're shocking. And I got some more information, and you may have too, from one of the administrators today, and it's a big number. I don't want to walk away from that issue with having Dr. Mixon, her level, which is very high, owning the problem, because I think it's a significant problem. And what I'd like to see, Dr. Markley, I'm referring to you as the CEO. Here's 3 things I'd like to have by the next meeting, and to address the issues that Bobby brought up. One is I'd like to have some clear understanding of the reasons. Not at a high level, not at others are having the same problem, but what are the training problems? Are the attendance problems? Are we not applying software appropriately? What are the reasons that are causing this? Secondly, and this is from you, Dr. Markley, because you're the only person who reports to us. The second one is, what are the actions you're going to take? What are the actions you're going to take, and how are you going to measure the effectiveness of those actions? Because this problem deserves your attention. And the third thing is, I think I've already said it in so many words. I want to bring some accountability to this issue. I personally do. Maybe my colleagues don't agree, but I want to bring accountability to the issue so that you and Dr. Huff need to be in charge of understanding this issue and dealing with it and solving it so that in due course, we don't have to worry about these kids. We're doing something for the elementary kids. We're bringing teachers back. Okay, at some investment and at some risk amongst the teachers. What is it we've got to do for the middle school kids? And I have not heard that tonight. And I want to know. And I want reasons, I want actions, and I want accountability. Now, is that asking too much?
We can get to work on that, Mr. Tody.
Thank you, sir.
Mr. Moore, I have a question or two.
Salisbury.
Dr. Markley, what have we changed the schedule, the structured schedule for our virtual students? I mean, is it, because I'm just listening and it sounds like, you know, the reason why there's such difficulties, and God knows I don't understand the depth of teaching, so please allow me grace there. But just from the part that I understand here, it seemingly is that we have not a static structure in place, that we have a moving structure for schedules. So is there any truth in that, my understanding of that? And then the other thing is, I appreciate all the information, and I'll allow you to answer, but I just want to get my thoughts out before I lose them. I appreciate all the information that's brought to us, but what I would like to see is the structured plan that says, this is what we plan to do. We always understand that the virus has impact on what we come to the conclusion of doing. But if we could just paint a vision as to where we want to be, what we want to do in the second semester, what is it our goal to go forward with all in person? Even if it doesn't come into being, I'd like to see us having a structure where we say these things. This gives us a vision. This gives us an idea of where we can go if circumstances present themselves. But when we get a whole bunch of stuff, I think I get drowned in all the information, to be honest with you. I want to see a structured layout plan of what the district wants to do in event that things go favorably towards the district as far as the virus is concerned. And then if you will just take that other question that I asked about the schedule, I'm curious about that.
Okay, we'll start with the first one. We have made some adjustments to the schedule over time, and not one where we've added anything. And Dr. Huff can speak to this a little bit, and I can speak to it as a parent of two high school students and also of an elementary student, that we've pared back on some of the instructional time for students. Do you want to speak to that, Dr. Huff? Make sure you have your mute off.
Yeah, I got to find my mouse first. Yeah, we have made some adjustments on the fly because a lot of what we're doing this year, it's first time ever kind of things. And so as we've seen the need to make adjustments, we've made them. At the beginning of the year, we gave the parameters of having 4 hours of synchronous instruction at least every day. And we have maintained that for all the grades. And remember, we had made the adjustment for elementary to go from full day, where we stretched it out across the entire day, to just moving them into the morning. We found that to be a little easier for the students to handle that, the instruction in the mornings. We did that with secondary from the very beginning because we found that same issue in the spring when we had the days stretched over, out, that the students started to fade and did not participate as much in the afternoon. And that's we're actually still seeing that. So now the afternoons are asynchronous, and we're seeing at the secondary level that that's where the students are fading, is during the asynchronous times. So they're not completing their activities. And that's where a lot of our Fs are coming from. And so as Dr. Mixon had said, it's multifaceted, and they are working on improving that. That is just one of the reasons.
Okay, let me ask you this, Dr. Huff. Are all of our teachers proficient in use of Zoom in class?
All is a big word.
Okay.
We do extensive training, and I will say that of the classes that I have watched, I have seen very solid use of Zoom, and I would say that our teachers are very adept at using Zoom. I have not heard of any issues that are extensive. And actually, there's some pretty advanced techniques. I'll just, an example of one we learned recently, like for kindergarten, K1, 2, it's very difficult to get the kindergarten, the K1, 2 kids, pre-K1, 2, to interact on their end of Zoom. So, you know, like on a Zoom meeting, like before I talked, I had to unmute myself, right? Zoom is set up in such a way that you can't, like the teacher can't unmute the kid because of privacy concerns. But we did figure out a way that the teacher can set up Zoom meetings so that at the beginning of the meeting, it gives you a little banner question. You know, would you like for the presenter to be able to unmute you? And we started doing that with younger kids. And now the teacher can unmute the kids instead of having to depend on the kid to do it. So we are continuing to learn the advanced features of Zoom. But yes, I would say all is a strong word, but all that I have seen are very proficient.
All right. Okay. I just
Mr. President.
remember that we have 19 people who have asked to address the board. We want to hear from them, but I would, before we do that, entertain some kind of motion about what you want to do here.
Mr. President.
Yes, Ms. Tittle.
I move to have secondary to remain virtual for the remainder of the semester.
All right, there's a motion and a second. There's a motion. Is there a second?
Second.
Second.
All right. Does the board have any other questions before we hear from the people who have asked to address the board? All right. Let's see. I hope you guys are all getting ready. Dakota Wilbur, are you out there? And then just so Melissa can be getting ready, Rachel Brown, you were number 2.
Hello, can you hear me?
Yes. Is this Dakota?
Yes.
Go ahead. And I would remind all the speakers that there is a 3-minute time limit tonight, and we've got a little counter on there tonight, so I won't have to worry about interrupting anyone. You'll see that and hear a little signal when your time is up. So go ahead, Dakota. Thank you very much.
Okay. Hello, my name is Dakota Wilbur, and I'm a senior at Raytown High School. Thank you for letting me speak tonight. Tonight, I'm going to go over a few points of why I disagree with the reopening plan. First, I want to talk about the many disadvantages of virtual school until January for secondary students. Secondary students are important too, not just elementary students. We are not doing well, unlike what the school district has said. We are struggling with grades. Data released from the Raytown schools over the weekend says 30% of students in middle school have a DOF in at least one of their classes. 36% of students in high school have a DOF in at least one of their classes for first trimester. The number of students failing classes has increased by 15% from last year. Grades will continue to fall if in-person isn't an option. There are many reasons for this. There are many distractions on Zoom. Many kids don't show up to our Zoom classes. Teachers also sometimes will dismiss the class after 10 minutes of instruction. Many students have Wi-Fi issues or have home life issues where they can't attend the meeting. There's also many students that aren't motivated to come to class because of only virtual is an option. By sending us back, students might be less distracted and be more motivated to complete work and boost their grade. Also, by sending us back, we get 8 hours of instruction instead of the 4 hours of instruction we receive now. This will help students learn more during that time. Next, I want to talk about the surveys released by the school district. No new surveys since school started. Survey results taken from family survey number 1. 41.4% of families wanted the students in school every day, and 41.2% of families wanted some kind of hybrid model. Only 16.5% want all virtuals. Over 50% of teachers want to stay virtual. This shows that teachers are favored over students. I also want to talk about suicide and depression rates. According to the CDC director, there has been another cost that we've seen, particularly in high schools, said. We're seeing sadly far greater suicides now than we are of deaths from COVID. Let's all work together and find out how we could find common ground to get these schools open in a way that people are comfortable and safe. Lastly, I want to go over my recommendations for the board. Let elementary and middle school return November 9th. Let high school students come back in November once the master schedule is complete. I recommend starting school either on November 9th or at the beginning of trimester 3, which would be on November 30th. This gives you time to complete the master schedule and time for parents to decide if they want to send the students back. In conclusion, let the families and the students decide when to come back. At least give us the option. And as me, for a senior, I am very unprepared for after high school, and by sending us back, I might have the option to prepare more for after high school. And please vote for either hybrid or 100% in person. Thank you for your time.
Thank you very much, Dakota. Appreciate that. Is Rachel Brown ready? And after Rachel will be Jennifer Blank.
Yes, I'm here. Thank you very much. My name is Rachel Brown, and I'm proud to say I am in my 8th year of teaching English at Raytown High School. In our last reopening committee meeting, several teachers shared our thoughts. Our comments were consistently referred to only as our opinions and passion, and were discussed as if that made them the opposite of practicality. I'm speaking to you today to share with you my passion and my opinion, both strongly rooted in practical experience and practical solutions for the problems that we face. Teachers are willing to work to improve our current virtual learning environment, and we hope to be a larger part of planning for what a return to in-person learning should look like. We agree that of course kids belong in schools. Of course teachers want to be in schools with our students. However, we want this to be done when it is safe and when we are given the opportunity to ensure that both teaching and learning will be improved by that return. If secondary returns in the next couple of weeks, teachers will be required to teach virtually and in person concurrently. If we are forced to take on concurrent teaching, we will not have adequate plan time. We will have to choose to either be unprepared or spend significant time outside of contract time to plan. Student learning will suffer as a result. With a return to in-person learning, we will also be asking teachers and students to add cleaning and sanitizing to their already overflowing plates, not to mention carrying the emotional weight of knowing that they are potentially being exposed to COVID, which could further expose their family and community. When you combine these struggles, we end up in an unmanageable situation that in no way will result in a better learning or teaching environment than our current virtual one. There's another concern I'd like to speak to that we are already facing. We have been told that teachers and staff will have to work from buildings when elementary returns. It is impractical to open our community up to further exposure unnecessarily. When teachers were required to work in buildings to prepare for the start of the year, it took only a week before I received an email that a positive case had occurred in my building and that someone in close contact was showing symptoms. Why are we being asked to take this risk? I realize that this is an administrative decision, but I ask the board to please discuss this concern. Please urge administration to reverse this decision and allow us to continue to work safely from home while we remain virtual. Additionally, any staff member currently asked to work from the building during virtual instruction who could complete their duties while working from home should also be given that option. In the best interest of students and staff, please do not return us to in-person learning under a concurrent teaching model. And please advocate for our safety by asking administration to allow all that are able to do so to work from home during virtual learning. Thank you very much for your time. I appreciate all of the care that you put into these decisions. Thank you.
Thank you, Rachel. Thank you. Jennifer Blank. And after Jennifer will be Carrie Plater.
Hello, it looks like I was just promoted to a panelist, so I'm here.
Go ahead, Jennifer.
Good evening. My name is Jennifer Blank, and this is my 8th year teaching at Westridge Elementary in the Raytown School District. Tonight, I'm speaking to you on behalf of the Raytown NEA and the 424 respondents to the Raytown NEA Return to School Preparedness Survey. Raytown NEA supports a safe and successful transition to in-person learning for our elementary and early childhood students and believes that following Ray Team's recommendations to continue virtual learning for secondary students supports the elementary return and is in the best interest of all students. In order to facilitate safe social distancing in the elementary schools, the plan was to utilize additional personnel from the secondary level. Moving these additional secondary support staff to the elementary level is an essential part of reopening elementary schools safely. If middle schools are open at the same time, that puts additional stress on elementary buildings as well. And concurrent teaching is not the answer. NEA elementary survey results. 56% of elementary respondents report a classroom size too small to accommodate social distancing guidelines. Approximately 30 to 50 elementary teachers will need to take long-term absences or terminate their contracts. 80% of instructional staff working with students in person already report a substitute shortage. 72.6% of respondents are worried they won't have enough plan time during in-person instruction, mostly tied to fear of covering absences. Concurrent teaching is leading to higher teacher turnover and burnout. I also humbly ask that safety always be the #1 concern. Administrators are working tirelessly to make a layered safety plan for in-person learning. However, when things look great on paper, they need to be implemented with fidelity by every employee every time, period. NPR reported on October 1st that children are super spreaders. Kansas City made the national news last week when area hospitals were forced to turn ambulances away. My own students have had parents and grandparents get sick and even die of COVID-19. And today it was released that 2 neighboring school districts have had employees die of COVID-19. Out of respect for our students and community, we can only return with safety plans not just planned, but implemented by all. In my experience with having students in my classroom during a pandemic, the best laid plans can still have flaws. The face masks provided were adult size, not children size. Sanitizing spray mysteriously disappeared. And when issues arise, it's assumed that fixing the issue is someone else's job, and we lack the fidelity to keep us all safe. We need some sort of protocol for communicating safety concerns with the proper personnel. To support a safe and successful return to in-person learning for our young learners, district energy, resources, and attention should not be expanded to secondary at this time. Thank you.
Thank you, Jennifer. Is Carrie Plater next? And then after Carrie would be Jenna Atkins.
Hi. Good evening. My name is Carrie Plater, and I am speaking to you on behalf of Raytown NEA and the 424 respondents to the Raytown NEA Return to School Preparedness Survey. Raytown NEA supports Ray Team recommendations to bring elementary school back at this time, but to leave the secondary virtual until semester. Today, I am speaking to you not directly about COVID-19, but about something I am an expert in, teaching. I am here to tell you that a rushed return to in-person learning at the secondary level is not in the best interest of anyone for so many reasons. Let's start with concurrent teaching. Concurrent teaching is when students who are both virtual and in person are in the same class. The teacher attempts to teach both groups simultaneously. As you can imagine, this is an impossible scenario. It leaves the teacher overworked, unable to provide either group with the quality education they deserve. We tell students to put their phone away in class because they cannot focus on 2 things at once. But wouldn't that be exactly what you'd be asking a teacher to do? To focus on kids on Zoom and kids in person? The sentiment from America's teachers about concurrent learning is not a good one. I have friends who are doing this currently, and they told me it feels like I'm drowning every day. It's like teaching 12 classes a day instead of 6. In this model, no one is benefiting. Furthermore, it is not supported by secondary teachers in this district. 91.7% of middle school teachers and 87.2% of high school teachers surveyed are not comfortable with concurrent teaching. I am a 15-year teaching veteran in this district, and I barely keep up with my workload right now. I cannot imagine trying to do double, trying to plan for both. It is panic-inducing to think about. Another solution that's been spoken about is hybrid learning. And while hybrid learning sounds like a great plan on paper, in reality, it just isn't. You still have concurrent learning because of the 100% virtual students. But even worse in this model, I see 2 students for 2 days, and then I do not see them again for 5 days without seeing me, hearing from me, or any other teacher in the building other than the assignments posted on Google Classroom. Right now, I or a colleague see students every day. We connect every day. Does going 5 days and in some instances more because of breaks with no direct instruction sound like a great plan? Better than what we have now? If you're worried about middle schoolers and high schoolers falling behind, they will be much more behind. In closing, Raytown NEA asked board members to wait to bring both levels of secondary back at semester. We suggest you ask district admin to lay out a specific plan of the steps they will take to make sure we are ready to safely return. This way, we can avoid concurrent learning. We can avoid a hybrid model that is best for no one. Virtual learning isn't better than in-person learning, but it is better than a teacher trying desperately to keep up with the workload that concurrent learning brings. It is better than coming to school 2 days and then having no one check on your progress for 5. Our motto in this district is to expect the exceptional, but bringing us back hastily is the board asking us to deliver a product that fails to serve students and is far from exceptional. I want students back. They are my joy, but I want it when it's right. Let's show every other district how this should be done. Thank you.
Thank you, Carrie. Jenna Atkins and then Sarah Apple.
Good evening. I'm Jenna Atkins, also speaking to you on behalf of Raytown NEA and the 424 respondents to the Raytown NEA School Return to School Preparedness Survey. We support a safe and successful transition to in-person learning for our elementary and early childhood students. We believe that delaying the secondary return to in-person learning will help support those elementary students returning to their building. There are only a few benefits that hybrid learning will bring right now. And right now, those benefits are not worth it to the change and upheaval that it would require to our secondary students. There were a lot of questions tonight about what do we do when our students are failing? Well, right now, we do everything that we've always done. We call home, we offer tutoring, we reach out to the parents and the family members and to the other teachers. We work with their advisory teachers. I worked with 5 middle school students today, one-on-one, and got all of their grades up above the failing level. It's that sort of dedication and work ethic that makes Raytown schools so successful. We will continue doing that and putting in that work and putting in that effort, even if we are virtual. It's not an even, that's just part of teaching. The format is not what is keeping things from going the way that you think that they need to be going right now. Hybrid learning means that students will go maybe 5 days a week without direct contact from their teachers. That's not going to improve grades. Concurrent learning means that virtual students are going to go from 4 hours of time on the computer to 7 hours a day of time on the computer. That's not going to improve grades. Should the district still choose to make those decisions and the delayed start date is November 9th, that would only give 14 to 16 days in the building. That's not going to be enough to improve grades. The super spreader events with Thanksgiving and Christmas and New Year's that could potentially lead to students being quarantined. That's not going to improve grades. If you still decide that that we need to be in person, that those magical 14 days of in-person learning is going to be enough, I don't believe that the district is going to have the staff to cover the absences that teachers are going to have from quarantine and needing to take extended leave offered, thanks to the extended FMLA. We just can't handle it. If we agree that elementary and early childhood need to be back, that is where we need to focus our energy and our time and our resources, our substitute pool, all of it. Let's get them back, let's get them rolling, and then we can see how far we can expand it. And ideally, those secondary students will be back in person second semester. We just can't rush it. I am happy to help you guys understand how teaching works, what a virtual classroom looks like. If you would like to join any of my classrooms at some time, I love a good walkthrough and an observation. You can ask my principals. They pop into my classes on a regular basis. I would be happy to have you come learn family and consumer science at South Middle virtually anytime.
Thank you, Jenna. Thank you. Sarah Apple and then Amy Lowe Smith.
Good evening. I'm a science teacher and coordinator in the district, and among other courses, I've taught about disease transmission and pandemics in microbiology for 15 years. As a district that claims to make data-driven decisions, we need to be focused on the scientific data when it comes to reopening our schools. SARS-CoV-2 is a brand new virus and science takes time. I emailed the board a summary of the scientific data available to us now, complete with citations. Unfortunately, with limited time to speak, I'm just going to hit a few highlights. We do know now that children and teens absolutely can get COVID, and they most definitely can spread it. Recently, the American Academy of Pediatrics released a study showing that more than 10% of all COVID-19 cases nationwide are now in children. And the rising numbers are very concerning as they reflect what's happening in our communities. The largest study done yet in India discovered that kids can actually be super spreaders, that they can be asymptomatic, which makes it very difficult to trace spreads within schools. And according to the CDC, we know that members of minority racial and ethnic groups are disproportionately represented among COVID-19 associated deaths, and that does include children. I appreciate the recommendations of DESE and Children's Mercy, but neither of those organizations are experts in infectious disease epidemiology. And what those experts agree is that in order for us to safely open up schools, we need to be looking at what's happening outside of the schools, not just in it. So opening safely isn't just about the adjustments that the schools make. It's not about our schedules. It's also about how much virus is circulating in the community. And one look at the local headlines recently will tell you that we do have a lot of virus. It's circulating in our community. We are making national news. I agree with Mr. Tody that news reports seem to conflict with Jackson County Health Department data, but I thought we weren't relying on that data because we were told that due to delays, that data was no longer accurate. I provided some information in the email I sent to the board about social distancing, 6 feet, 3 feet. The reality is experts don't agree. It's not about feet, it's about the situation. And so 6 feet outside might be great. 6 feet indoors with windows closed, like they will be in the wintertime, will not be sufficient. My recommendation is that we do not return in person on 10/26 or 11/9 or any other arbitrary date on the calendar. The decision to reopen our schools should not be based on quarters or semesters or personal opinions or desires. We need to base our decision on the scientific research and put safety first. We must deal with COVID numbers in our community first. To reopen now is to put the cart before the horse. Until we get case numbers under control, anyone who can teach or learn from home should. To reopen right now, as cases are surging in our area, would make our schools active participants in the spread of a deadly virus and further exacerbate the pandemic in our community. Thank you.
Thank you, Sarah. Amy Lowe Smith and then Brian Wise.
Hi, good evening. This evening, I'm going to represent Raytown's MSTA. I'm worried that we do not have Title I teachers in our school this year. We have struggling readers and math students who require this support to boost their academic skills necessary for success in class. I hope that you are able to staff next year our Title I and it will be able to resume. Lack of Title I also makes the progress for students to be identified for special education much more difficult, and it prevents our most struggling students from this much needed intervention. Currently, MSTA does not support a hybrid learning plan. It gives students 2 days a week for instruction where they've been getting 5. The gap will just continue to get bigger for those struggling students. We also do not support concurrent teaching. It was mentioned in this meeting that what does the teachers do? They just need more training. Wow, I think that's kind of hurtful for your staff when you have staff members who are extremely trained, gifted, talented, and dedicate their life to students. Concurrent teaching is like being an auto mechanic. You're the Jeep mechanic, then someone brings you some Fords, and then the next thing you know, you're asked to fix an airplane. That's how it feels to us. It just piles on more and more. It's not that teachers need a different training. In order to teach concurrent teaching effectively, you would have to have a different microphone system for the students in class and online to be able to be heard at the same time with different speakers. So it requires more technology, not just your teachers getting a little more training. It will also put more strain on our staff as they are trying to juggle too many things. I understand students are struggling now, but how much more will they struggle if we move them to virtual, if we move them from virtual to hybrid? The other concern that MSTA would like to present tonight is that we make sure that dashboard has a timeline and goes active within the next week so that our families and our staff can make informed decisions whether or not they might need to go on FMLA or if they send their student to school. So I'm asking you to please put a deadline on when that will go live. Thank you.
Thank you, Amy. Brian Wise and then Mary Regan.
All right. I want to make a quick apology to the board for throwing an opinion in while I was presenting as a member of RAE team. That was inappropriate, and I do apologize for that. Tonight, I'm just speaking for myself. And the thing that I want to do is I want to thank each of you board members for listening to us, for the people that gathered all the data that they shared with you this evening. And I want to support Dr. Markley in suggesting that what he has recommended is best for all of our secondary students and staff. Like I said, I want to apologize for throwing an opinion out there that was inappropriate. I do apologize, Mr. Burton, because it wasn't part of the RAE team presentation. That was an opinion of mine only. Thank you for your time this evening.
Thank you very much, Brian. Mary Regan, and then Bridget Pitts.
Sorry. Hi, my name is Mary Regan. I'm a special education teacher at New Trails, and I'm a member of Raytown NEA. I will be sharing results from the 424 respondents from NEA's Return to Learn survey with a focus on data from those of us that have been back in school for the last 4 weeks. There's not many of us, but the students and staff that have been in person are those of us in special education classrooms. We're back because we know that in-person learning is what's best for our kids, and we're not disagreeing with that. I've loved being able to be back with my students, but we believe that our experiences in person can provide good information and insight into how it's going for staff members, and we hope that this information can be used to help guide safe decision-making as we move forward. So some data that was shared with us is 48 respondents say that safety measures are followed 100%. 58% of staff have fear for their personal health, and 64% have fear for their family's health. These fears are not unwarranted given that 78% of staff back reported having staff or students in their programs under quarantine at some point in the last 4 weeks, and 39% reported students or staff in their programs testing positive for COVID. 88% of staff have reported missing substitutes when staff are absent. This causes classes to either be combined into other rooms and therefore breaking their static groups, or going without teachers. And I imagine this number would only grow as we add more teachers back into the classrooms. At last week's meeting, it was also said that special education teachers are the ones getting sick and have more exposure. So I asked, what are we doing to mitigate that risk for us and for our students? How do we ensure that special education teachers and students are just as safe as everyone else going back? Mr. Burton, last week you said our numbers are still unacceptable and asked what we can do to do better, and we tend to agree with you. For those of us back, as our survey shows, things do not feel like they're going particularly well. Additionally, our data shows we must address the mental health of our staff and take that into consideration as we make decisions moving forward. We already know that about half of new teachers leave the profession within 5 years, and without transparency and support throughout the entire district, this number is surely going to increase. In closing, Raytown NEA believes that we need to fine-tune and improve the systems that are currently in place before we tackle the challenge of district-wide return to person. Thank you.
Thank you, Mary. Bridget Pitts, and then Amy Kempf.
All right, can you guys hear me now?
Hi, Bridget. We can hear you, but we can't see you.
I'm working on it. There we go. My apologies. Thank you. Okay. All right, good evening. Thank you for the opportunity to speak with you this evening. I do appreciate it. Again, my name is Bridget Pitts. I am a teacher at Northfleet Elementary, a resident and parent of students in the district, and president for our Raytown MSTA. I would also like to say up front, there are many strong feelings on both sides of the fence and all memberships. No one is wrong. All feelings are valid and deserve to be heard. People are scared and want to keep themselves, their families, and our students safe. People want their students to succeed and are heartbroken watching them struggle through a monitor. What I am presenting here are based on the facts as I know them of our situation. At a state level, MSTA believes science and the recommendations of local public health agencies, not politics, should drive decision-making about opening public schools. We have unfortunately been told we cannot rely on this data due to it is delayed. In regards to both middle and high school students coming back prior to January, the success really comes down to scheduling. We have learned from our surrounding districts, hybrid teaching sounds good in theory, but does not work well. Concurrent teaching is equally difficult for both teachers and students. Teachers would now be managing behaviors of 2 classes simultaneously, addressing questions and class discussions of both. It is physically impossible to watch 2 classes at the same time. Students in both the virtual and in-person setting will be missing out on learning opportunities. The other problem we have for concurrent teaching is needing microphones for our virtual learners to hear. If a student moves away, if the teacher moves away from the front of their computer at all, the virtual students can no longer hear them, nor are they able to hear any class discussions or questions being asked by in-person students. I believe if we return middle and high school students now for schedules to work, we will be concurrently teaching across the board. If we allow the time for schedules to be adjusted, we would have the opportunity to reduce concurrent teaching as much as possible, along with acquiring equipment needed. MSTA is not in support of either middle or high school students returning this semester. On a personal note, we just started real virtual teaching. The spring was really emergency teaching, and we've gotten in the virtual boat right now. My own middle school student has just started getting into the swing of how this works, and I believe teachers are as well. I've also recently just started having weekly Zoom meetings with some former students with their advisory teacher. This has helped them be motivated to attend their afternoon tutorial times and is so far helping increase their grades. I believe students and teachers are now developing those relationships we know is vital for our student learning. I am pleased to see our district is planning to now be transparent with our own COVID data by having a link on our website to a dashboard displaying this data with numbers only. I do not wish for anyone's privacy to be compromised. It shows transparency and honesty. I believe this aids in the trust our staff and our community members have with our district, and I would request that the board ask this dashboard to go live by October 26th, since that is the first day of in-person learning for elementary students. Thank you very much.
Thank you very much, Bridget. Amy Kempf, then Noel Bond.
Thank you. Thank you, board members and attendees, for allowing me this time. I'm Amy Kemp, and I'm an English teacher at Raytown Middle School, and I've been teaching for 19 years. Teachers are continuously hearing to be consistent in everything that we do, make our decisions based on the data that we're told. Let's talk about that data. We have 8 million COVID cases in the United States, 70,000 new cases reported every day, and 25% of Black and Hispanic cases result in death. This is our Raytown community, and these numbers are terrifying. If we uproot weeks of consistent virtual instruction, the data could show that it cost us more than gained. Teachers will be expected to teach simultaneously, virtually, and in person. Our responsibilities will mound, and you know we will work well beyond our contract hours because our kids need us, and that's what we do. Double planning, double grading, double attendance, monitoring, etc., with time cut in half. Teaching is hard enough, and doing both is nearly impossible, not to mention the behavior problems that we will have to remedy when we return. These students will get less classroom and individualized instruction. Many student schedules and teachers are going to change, and undoing the process we have made, the progress we have made. It is taking time, however. I know that my students are now making progress. They are understanding that they need to participate and complete assignments as well as use the tutorial time. We are showing inconsistency in our ability to make a decision and stick with it. And right now we are giving kids instruction, independence, and safety at the same time. It's going to take a while to recognize the successes of virtual learning because it's new, and new is sometimes hard, but let's not confuse hard with I don't want to do my work. To be frank, we are holding this meeting right now virtually because of safety reasons, yet it is seemingly okay to consider putting students and staff at risk. I'm not a soldier, a healthcare worker, a police officer, or a first responder, and I should not be expected to give my life when there is a perfectly viable alternative that is working better and better each day. While there are plans for safety concerns, Dr. Huff stated that social distancing will not be possible at the secondary level. What will we do when parents send their children to school sick and happen to spread the virus? What will we do when we need class coverage and don't have the subs? We have to think about replacing teachers who may have to leave in the middle of a contract because they can't risk exposure. What are we going to tell a kid who brings COVID home to their parents and their parents die as a result? And what reason are you giving to the many students who have already experienced this unnecessary trauma? I know that not all students live in happy homes full of kittens and rainbows, and I wish with everything that I am that I could change those circumstances. But the fact is I'm not their parent, I'm their teacher. And you're asking me to risk my life and my family's life to teach English. That's pretty bold. Emotions run high on the topic of returning to school, but we must listen to the science, to the data. We must be consistent. I will always do what is best for my students, but I can't do that if I'm not present. And while I know your responsibility is to the students in our community, you have no school without your teachers. You, the board, are a valuable part of this district, but you are not on the front lines of this system. We are, and we also are valuable. Thank you for listening. What will you do with our lives?
Thank you, Amy. Noel Bond, and then Jennifer Ernst.
Good evening. Compared to many of the people in this meeting, I'm relatively new to Raytown. I've been a teacher at Raytown South for 5 years. During that time, I've come to love the school district, the community, and most importantly, students that make up our school. Our staff and student population has incredible ups and downs, and the communication that our teachers and administration build with our students is closer and more important than any school I've had the opportunity to teach or observe at. I'm incredibly thankful for the ability to conduct my career here at Raytown. I'm excited to continue it for years and years to come. Obviously, this year has presented us all with unique challenges and hardships that we've not faced as a nation in our lifetimes. I've been proud of the way our district and board has risen to meet them, and by moving political arguments to the side and heeding the guidance of community health organizations. As a teacher, I would much rather be in class working with students than spending the day on Zoom and communicating through email. Being in the classroom is what I was trained for, what I prepared for, spent years doing, ultimately the reason that I chose this career in the first place. I can assure you that very few teachers got an education because they wanted to be behind a desk for hours on end. Teaching virtually is an entirely new skill, one that very few of us had experience with prior to this year. I can only speak for myself and the few teachers that I've discussed this with, but it's much harder than teaching in the classroom. Lessons that we've spent years tailoring to student needs now need to be thrown out and recreated using technology that we didn't even know existed only a few months ago. However, if the inconvenience of virtual learning means saving the health and possibly even the life of a single member of our administration, staff, community, and again, most importantly, our students, it's imperative to err on the side of caution. I personally have no firsthand experience with the virus. My wife, however, is a respiratory therapist at a metro area hospital who works directly with COVID patients. Night after night, she comes home with stories of her patients slowly declining, scared, alone, and with no family members surrounding them. These are members of our community who are dying. People that we've worked with, that we've met at the store, that have served us, that we've grown up with. I hope that none of them have been members of your family, but they were all members of someone's family, someone's father, mother, someone's son, someone's daughter, someone's husband, someone's wife. As a frontline teacher, I believe that we should not risk the lives and health of our children and our community members in order to gain a few in-person days in a semester that's been completely virtual to this point. It's taken so long to gain a feeling of normalcy in our virtual classroom. Students and teachers alike have just figured out how to succeed in this new situation. What's the benefit in shifting thousands of student schedules halfway through a semester to present our students with a new set of challenges and obstacles to their learning, all the while raising their risk of exposure to themselves and their families? High school students have adult bodies with adult symptoms and are spreading the virus like adults. This puts teachers and families at risk for contracting COVID. How many teachers and students are we willing to risk? Come to our virtual classrooms, see what we're doing, see what our teachers and students are learning. Please take a moment to think about these repercussions. Vote not to reopen until after the semester. Thank you.
Thank you, Noel. Jennifer Ernst, and then Crystal Kane.
Can you guys hear me? Yeah. Hi, I'm Jenny Ernst, an 8th grade English teacher and Teacher of the Year for 2021 at Raytown Middle School. And I've been teaching for 15 years, and I wanted to share my concerns about face-to-face as well as the benefits I've noticed in virtual. At the last board meeting, there were requests for data, and I have some to share. According to several studies done locally, regionally, and nationally, Black and Hispanic children and adults are getting and/or dying from COVID at higher rates than white. Raytown Quality School demographics are African American, 48%, while white at 28% and Hispanic at 13%. Hickler Mills Center, KCK, and KCPS school districts are either the same size and/or same demographics as Raytown and have all decided to remain virtual at all levels until January. We are not Lee Summit nor Blue Springs district, and this is not about missing out on traditional activities and events. This is about keeping all of our Raytown families safe. Personally, 3 of my students have lost their mom or guardian to COVID here in October. Shifting from virtual to in-person will result in huge losses of instructional time if we do it in the middle of the semester. One, lessons and instruction currently in progress will be stopped in order to teach classroom and building procedures to students, which will take about 2 weeks. Then you have Thanksgiving break, Christmas break, all those other things. Emergency drills will take more time due to following CDC guidelines. Trauma, anxiety, and disruption to routine because of quarantines, long-term illness, death of a loved one, and fear of contracting COVID will result in loss of instruction. There is a silver lining though, and I think we're missing out on seeing a new opportunity that is being given to our kids. In my classes, students have been more active in their learning. They can't look at their neighbor's paper anymore. They can't be passive learners. They're starting to ask deeper and more specific questions. I don't hear, I don't get it. Instead, it's I'm confused on section, or what do you mean by? I'm getting more participation in class discussions now than a regular school year. Chat on Zoom is a game changer. These kids are the generation of texters. Chats work great, which means I'm teaching them where they're at in a relevant manner. A student can privately ask me a question and I can privately answer that question. This cuts down on students embarrassed to ask for help. When they are struggling, they can reach out immediately and privately in that moment. My students who need to tap, fidget, make noises, move around can without disrupting my lesson or those around them. Shy students who are afraid to interact in front of everyone can turn their screen off, answer the question, then turn the screen back on and continue with class. The bullying comments that I cannot always hear are no longer happening in the virtual classroom because they cannot privately chat one another. They have to publicly chat or verbally interact with one another. I realize that virtual is not what we are accustomed to. I also realize that virtual is not 100% best for every kid, but neither was regular school. We are on the verge of accessing a new learner and new learning style. We're seeing different students thriving and interacting. So instead of pushing back, maybe we could lean in and see the positives that are occurring because of virtual teaching and learning. Please allow us to continue the safe and exciting new virtual direction we are headed.
Thank you, Jennifer. Crystal Kane was the next speaker on the list, but we don't see Crystal in the room. Is Crystal Kane in the room? If not, we'll move on to Anna Hoffman.
Hi, good evening. Can you hear me?
Yes.
All right, good evening. My name is Anna Hoffman. I am a senior at Raytown South High School. I addressed the board previously on returning to school, and I'm speaking again tonight to urge you to keep secondary virtual. I begin in-person instruction with Herndon's nursing program a week from today. Once I begin in-person instruction, I'll be in a classroom with students from multiple districts, and I will not be social distanced. In the classroom, I'll be practicing my nursing skills, which will require me to work closely with a group of 3 to 4 people. If secondary returns in person, I will have to return in person in order to take my college level classes. Are you okay as a board with knowingly sending a student who isn't able to socially distance to a school full of completely different students and staff? Are you okay with bringing staff and students into school, knowing that Olathe and Park Hill both lost staff members over the weekend to COVID-19, one of which was also a college student closer to my age than yours? The St. Luke's system, as multiple people have addressed, is bursting at the seams. It is averaging 85 COVID patients a day in the first 14 days of October. That is a major step up from September's 63. The hospital system is so filled with COVID patients that they are canceling ambulance services because there's not enough room in the hospitals. Going back to school would do everything but help these hospitals that are already bursting at the seams. I know several students that have already contracted COVID and had to be treated. Remember, I just want this district to remember that this pandemic is not about doing what's convenient for us or what you find convenient. It's about doing what's right for the greater good. Thank you for letting me speak, and I really hope that you do what's right for the greater good in this community this evening.
Thank you, Anna. I believe Crystal Kane is in the room now. Crystal Kane, and then Tracy Williams.
Are you able to hear me? I'm sorry.
Yes.
Okay, I've been here the whole time, but it wouldn't let me get on.
Go ahead, Crystal.
Okay, thank you. I apologize for speaking fast, but I have a lot of things to say. I feel like I'm the only parent out of these 19 people that are here, and that's pretty disappointing to me. I've heard from a lot of teachers, and while I understand Their situation, I don't necessarily agree with everything. Going back to some of the things that was talked about in the last meeting, I think it's great that K-5 is going back. I thought it was great that somebody started to fight for the secondary schools to go back, but then it kind of turned into only the middle school being cared about. These high school kids are about to, some of these kids, these seniors are about to be fed to the sharks of the real world. And I just don't understand why they're not getting what they need from their last few years of school. I can't speak for all of these parents, but there are several that I'm speaking for tonight. My daughter, for example, is an honor roll student. She just came home with her first D. My niece is new to the district and is a freshman. As outside of the school sports, she does not know her way around the school. She does not know any of these people, any of these students or teachers. As far as her schooling goes, she has okay grades, but one of the other previous teachers was speaking to how they can't look at their students' paper next door. You're right, they can't look at the students' paper next to them. They can, however, FaceTime each other to cheat. My niece was asking Siri what her math questions were the other day. I just don't feel like the less than 4 hours of school that they are getting is beneficial to them. What blows my mind the most is that there was no return plan. One of the speakers last week was speaking to how far the schedules are done in advance. When we were put to September 8th with the first 2 weeks virtual, we all assumed we wouldn't be going back, but we had hopes. Then it was moved to October 6th, 26th. When I came into this meeting today, I had zero hopes of them returning before January. Then there was the proposed plan to return November 9th. And I thought, great, somebody's finally caring enough to send them back. Now we're talking the middle of January again, if then. That is more than half a year of school that these kids are going to be out of school if you include the 2 months that they missed last year. And I get that these teachers and these students are all at risk, but everybody's at risk when they go to work at some point. I'm a hospital worker. I can't quit my job because I might be at risk. The military can't quit their job because they might be at risk. I just don't feel like anybody cares enough about the kids to get them back in the school. And I apologize for sounding so upset, but that's where I'm at.
Thank you, Crystal.
Thank you. Thank you.
Tracy Williams, and then Kat Hoffman.
Hi, my name is Tracy Williams, and this is my 19th year teaching at Raytown High. I also have a sophomore son at Raytown High School. I'm also the person who established the Facebook page RQS COVID Reaction, which includes over 500 members of the Raytown staff. I have chatted with cafeteria workers, K-12 teachers, IAs, bus drivers, and office workers. With that said, I feel the need to express that there's a level of fear in this district, and I'm not referring to the fear of COVID. I'm referring to the fear of employees to express their concerns and ideas out of possible backlash from their supervisors. So I'm here to speak for some of them who have shared some of their concerns with me. I have a coworker who wants to leave the field of education after just 2 years. She does not believe this school district has her safety in mind during this pandemic. I have a coworker whose mother is elderly, and she worries about giving the virus to her if opened up to more exposure here at school. I have a coworker teaching K-5 that feels like she is being treated like a guinea pig. I have a coworker that is worried about scheduling changes for their child at the elementary school, and I have coworkers that are extremely worried about the scheduling changes for special ed classes. I have coworkers who do not trust students and staff to keep the school clean. I have coworkers who wonder how many times they will end up in quarantine as the school year continues. I have coworkers who are worried about how school safety will be enforced and how you're going to make students wear masks if and when we come back in person. I have coworkers who worry about filling sub jobs. Teachers will end up subbing, no doubt, and will take away critical planning time and put teachers at additional risk by exposing us to more people. I have coworkers who coach sports and who have not been provided the safety equipment they were promised. I have coworkers who are worried about our African American population. According to Dr. Sharita Golden of Johns Hopkins, people of color, particularly African Americans, are experiencing more serious illness and health due to the COVID-19 than white people. We ask that you take our situation seriously. I have heard that we are referred to as essential workers by the people at the admin building. And yes, I consider myself an essential worker, but what are you going to do to protect your essential workers? Because right now, many of us do not feel very protected. Thank you.
Thank you, Tracy. Kat Hoffman and Melissa Sterling Bardwell.
Hi, I hope you guys can hear me and see me.
Yes, go ahead.
Okay, first, thank you for allowing me to speak this evening. Please forgive me as I will be reading my thoughts so that I do not leave anything out. I am speaking tonight as not only a parent and district alumni, but also as a voice for the 60% of staff that told you in the Ray Team survey they don't feel safe returning to school at this time. Ray Team has spent many hours collectively trying to help come up with the best solution for both students and staff. And in one night, you let it be known you have no desire to listen to Ray Team or staff unless it aligns with what you have decided you want. I would like to know why we are back to holding the Board of Education meetings via a virtual setting once again. Is it because you do not feel safe in a room together, or is it because you are afraid to face parents, students, and staff? I cannot understand nor fathom how some board members would push for secondary in-person return when they have not returned to the Board of Education meetings as an in-person participant, even though in-person meetings were held in September. Why is it safe for students and staff to be in a building with hundreds of others, but not safe for you to be in a room of easily less than 50 individuals? I thought our district would be safe and transparent. I am learning how incredibly wrong I was. We have already had 2 elementary schools quarantine employees, along with an entire high school football team and coaches, and now an entire high school basketball team as well. This has all occurred since September 3rd, and these are just the ones that I know of. I guarantee there are more that we have not been made aware of. I do not blame any member of the staff who is not feeling safe. I do, however, blame you as a board for not listening to them or their fears. A considerable number of our staff here in Raytown are also Raytown alumni. They return to this community because of the proven reputation associated with Raytown quality schools. They believe the school district would continue to work in the best interest of students and staff, and now the board of the same district is turning their backs on them and others. I understand that each person is allowed to have their perception of how dangerous they believe COVID to be, whether wrong or right. What I do not think of as appropriate is this board telling those who are concerned, overwhelmed, and fearful that their thoughts and feelings towards COVID are not valid. And that is exactly what this board appears to be doing when going against the 60% of staff who filled out the survey sent out by the Ray Team. In closing, I would like to request you honor our lost member of the Raytown School District family with a moment of silence for the time that she dedicated to this district and food services before her passing in the beginning of April due to complications from COVID. Thank you.
Thank you, Kat. Melissa Sterling Bardwell, and then our final speaker will be Renee Miller. Is Melissa Sterling Bardwell still in the room?
Yes, can you hear me?
Yes.
Okay, this evening you have heard countless facts and opinion about COVID. I believe what I'm about to share with you should be of greater concern to you and all educators, and I am not sure why no one is speaking of it. I recently heard a story about a teacher who said, "I love working at home. My kids are doing well virtually, and it's not worth the risk to come back." I am grateful that this teacher and her kids are privileged enough to be in a home where they are safe, consistently have access to food, stable Wi-Fi, parents at home to work with them, and space for all of them to work in separate spaces. But what about our students who don't have those privileges? Who is fighting for them? What about our students who are distracted because they are feeding babies or have siblings running around the house, spotty Wi-Fi, no adults at home to help or tutor them when they need to help with their work? What about our students who are not privileged enough to live in a home where there is food, a stable income, and a place to lay their head at night? How about our students who are living with a drug-addicted family member or are hiding in their rooms trying to avoid domestic violence, or even worse, stuck at home with their abuser? What about our students who are struggling to get out of bed, to find a reason to hope that their life will ever be as privileged as the teacher and her children mentioned above? Should that teacher feel guilty about their children doing well virtually? No, absolutely not. But I do hope they realize that they cannot assume that because their experience is going well means all students are as privileged as theirs. These are a few of the alarming statistics regarding the impact of COVID and virtual learning is having on students. Missouri Child Abuse Hotline reported they have received 40% less calls in April of 2020 as compared to April of 2019. In May, they had 54% less calls. The reason that the hotline calls were down is not because abuse wasn't happening, it was because the abuse isn't being reported. Prior to COVID, 22% of students reported receiving mental health services. Since COVID, 32% of students who were not receiving mental health services now feel they need them. That means over half of our students are in need of mental health support. Social distancing and school closures will increase mental health problems in children and adolescents due to isolation from their peers, teachers, and extended families. There are many concerns about suicidal ideation during this time, as isolation is one of the top risk factors for suicide. Suicide is the second leading cause of death to adolescents aged 12 to 17. Here are some of the words used by students from my school. I can't learn like this. I'm going to fail. I'm so lonely. My dad died and now I'm all alone. I'm overwhelmed. I want to come back to school. I sit at home alone all day and night. You have heard many times that we need to stay virtual and not expose ourselves or others to this virus. The more I hear this, the more I realize we have a philosophy difference. I believe educators are just as essential as healthcare workers. We are needed. Healthcare professionals have been battling the front lines since day one with those who are actively contagious and battling COVID, but they choose to put the needs of others first. We should find their devotion humbling. Some doctors' visits can be virtual, many cannot.
Thank you, Melissa.
Yes.
Thank you, Melissa. Renee Miller.
I'm here. Can you hear me?
Yes, go ahead.
Okay, dear board members, I encourage you to bring our middle school kids back, even the high school kids back in person as soon as possible. I have a student in elementary school and a student in 7th grade. My son has autism and is in resource classes and receives speech therapy services through the district and has an IEP. Yes, accommodations have been made to attempt to help him. Honestly, he is doing well, but don't be fooled. I have to sit with him for all of his classes. He needs help with typing, reminders to listen, and staying on task. I can't do anything else. I have another student at home that needs help also. Speech therapy services were never meant to be taught over a computer. What his speech teacher would normally teach him at school has been drastically changed due to virtual learning, and not for the better. Picture this. You have a student that struggles to pronounce words right. The same student stutters while they talk. You're on the other end of a computer trying your hardest to hear your student pronouncing their words. But wait, there's a Zoom delay or a lag, or even the student's screen freezes. Yes, this does happen. My son has not received a proper speech lesson since school closed in the spring. His teacher tries her absolute best, but virtual speech therapy does not replace in-person, and it does not allow them to learn some of the most important things that they need to know. Social skills class, another class my son takes. Could you teach students with learning barriers over a computer how to have appropriate conversations in social settings? Teach them how to regulate their emotions? Could you teach them appropriate social behaviors that would help them make and keep friends? You can tell them these things all you want, but it's hard to model these behaviors and practice them with the students over a computer. Resource classes. Students at different grade levels are in those classes. Virtually, they all learn the same thing at the same time, at the same speed. In person, the teacher is able to work with each student at their level. Regular classes, the teachers have told their kids, it takes 2 weeks to learn virtually what they would learn in 1 week at in-person school. Kids are asked to Zoom and Nearpod and other things all at the same time. It bogs down, it freezes, it kicks them out. They miss part of the lesson. Currently, sports, especially contact sports, are allowed to be played, but my son and other students receiving similar services and in similar classes are not allowed to sit at a desk in the classroom at school and get the education they need and deserve. Allowing sports and not in-person school is like saying it's okay to potentially be exposed to COVID while playing or watching sports, but not okay to be in school and potentially exposed. Thank you for your time.
Thank you, Renee. Thank you for everyone who spoke to the board this evening. As you can see, there are very emotional viewpoints on both sides. And like we've said from the very beginning, this is very difficult for everyone involved. All right, so there is a motion and a second on the table. Do any other board members have any other questions or comments before we vote on that motion?
I have a question. Oh, go ahead, Amy.
No,
Oh,
I don't have a question.
Mr. Burton.
I'm reading over the options, and it says social distancing would not be possible for 100%. Some classes will be concurrent for hybrid, and continuity and instruction would be for virtual. So is this saying that how will we be able to go 100% on the current if social distancing is still being mandated or is a guideline? Ever? Or in January?
Trying to understand your question. You mean 100% of our actual students enrolled in the high schools, Mr. Burton?
No, it says 100% as one of the options. I'm asking, it says social distancing would not be possible. I'm asking a question about, actually my question is about even in January, with the 100%, the maximum class size being 17 to 20. It says social distancing would not be possible. Is that?
I can answer that for you, Mr. Burton.
Okay.
When we go in January, where our goal is, we're going to open up, really no matter what the vote is tonight, we're going to open up a window for secondary for parents to make the choice for second semester. And then we're going to master schedule for second semester. And what we're going to do is we're going to purify the in-person and virtual classes so that we don't have this problem of concurrent teaching. So a teacher can have just a virtual class or just an in-person class as one. So there will be some concurrent teaching because there's still going to be some classes we're going to have combined, like band. We'll probably still have combined vocal music, and maybe even some classes like that we offer just as singleton classes. So maybe like a physics class might still need to be that way. But by and large, we'll have them separate. It's actually going to make social distancing harder at that point in time, because then the in-person classes are going to be full. We're going to have 30 kids in the in-person class. And so what you bring up is a real issue that the board definitely needs to consider as we look forward. We're going to create a scenario that in January, the in-person classes are going to be very large. They're going to be back to regular size. And so if we're looking at 100% returning in January, we would need to have the virus need to be in a place where it would allow us to have that many folks in a small classroom environment. So we definitely do need to think about what the Jackson County Health Department regulations are, and even the city of Kansas City. And if they have us under regulations where we have to, certain number of people in a certain size of space or whatever, then we would have to take it into account.
All right. Okay.
Whatever we do here now, there's still a lot of work and a lot of different things that have to be going on between now and then. So,
and that's one of the things that that I want to say now is that we know where we are right now. We know that the virus is trending the wrong way. Where we in our district, outside in our community, but we know we're not ready. We're not ready to go in person, at least secondary. I mean, I personally feel like we're not ready at any level, but we're not, because we don't have a lot of things in place to be able to do it. Hybrid doesn't seem like, it's not even a recommendation of the administration or Ray team. And they make a compelling case that I think I would support, but I'm just thinking, are we gonna be, is this, I think the date, we shouldn't choose some arbitrary date. I think we should, like Ms. Bobby said, we should make a coherent, viable plan that we know when those circumstances exist, that we can pull the trigger, that we can go. But I don't think the virus is at a point would allow us to even consider going back. And I don't think we're ready. I don't think we're ready at the point where our community is dealing with the virus. That's all I gotta say.
Just to elaborate a little bit, by separating those classes out into virtual and in person, it will allow us to be more flexible on a return after that. So a lot of the arguments that you heard tonight about the hybrid and the concurrent teaching and all that will be largely taken care of when we master schedule to separate out those in-person and virtual classes. And so that will allow us to make a decision, if it's not in mid-January, make a decision that might happen in February or March, when numbers are at a better place. So we will be better aligned to be able to make that decision after we go through and master schedule again.
I guess that's what I'm getting at, is that we don't have that right now. And so because we don't have that right now, I don't know how we can consider going back in secondary right now. And on top of the fact that we're going into winter, the virus is trending in the wrong direction. We need to make sure, my concern is that we need to make sure that we're ready whenever the time is right. The timing is not right, we're not ready, and it's not safe. Because even if we got to make people not only be safe, we got to feel safe. You know, those are two things we need to work on. I think we need to look at what can we do in our community, inside our district and out, to increase the safety, to promote the measures that we need to have to drive the virus out. I mean, we talk about what we're gonna do, but we're not really talking about mitigating the risk or making people feel like it's a risk they're willing to take. It's not very inspiring.
All right, there's a motion on the table to continue secondary education virtually for the rest of this semester, and a second. Any other comments? All right. Voting on the motion, Mr. Landers.
Yes.
Ms. Salisbury,
Yes.
Ms. Tittle,
Yes.
Mr. Burden,
Yes.
Ms. Plank,
Yes.
myself, yes. Mr. Tody.
Yes.
All right, thank you. I'm sure the administration will get to work on all these different things that need to be discussed and putting out the information to the community. Is there a motion to adjourn?
Mr. President, I move the board adjourn their special Board of Education meeting at 10:10.
Is there a second?
Second.
All in favor, say aye.
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 Opposed? All right, thank you very much. Thank you for all those who joined us this evening and for those who spoke. Thank you for all your hard work. Good night.